I invite Dr. Kunal Srivastava to talk about one of the options for myopia progression management, the scientific insights from the peripheral defocus lenses. Over to you, Srivastava.
Thank you so much, Ramesh sir, and thank you, APO AIOS. I'm really honored and humbled to be on this dais. In next around 7 to 8 minutes, I'll quickly walk through as to what is the design and what have been the clinical outcomes. So let's get to it. These are the disclaimers. This is for educational purposes only, not promotional. Let's look at what is Essilor Stellest design. Now, one thing that is there is you have to give correction, and this is what is the basis of it. You have correction, let's say from -1 to -12 that you have. But along with that, you also have treatment zone. Now, these treatment zones are based on 11 concentric circles, which are made up of highly aspherical lenslets. Now, there are 1021 lenslets, there are 11 rings. Their asphericity is same in each ring, but it differs when you move from inner to outer rings. How does it work and why exactly we are having highly aspherical lenslets? Let's focus through one lenslet. Now, these are highly aspherical, so when light rays fall through it, rather than being in one single plane, they form a volume of myopic defocus. Now let's imagine one ray of light falling through it and how it will form a myopic defocus. Let's call it the microelement. But we know it's never one ray, it's a beam that goes throughout. So there are multiple beams, and eventually what we get is a macro element of volume. So if we are using a Stellest lens, you are getting the good correction. Along with that, when we combine this micro and macro element, what we get is a shape of volume of myopic defocus. Now this forms kind of a shell right in front of the retina and in the shape of retina because of how all the rings and asphericity is decided. So actually, if you see, this is how it looks like. And because of the design, how it is, you have around 40% of treatment zone and 60% of correction zone. So it doesn't matter what is your gauge, you are going to get sharp central image, and you are going to get a very good signal of volume of myopic defocus. That is a signal to stop the progression of axial length, and thus helping in controlling the progression of myopia. Now, one question that also comes into our mind, what happens to visual performance and how good is the adaptation? Now, in our study, progressive 2-year randomized control trial, what we saw is that almost 90% of children, they got adapted to this lens within 3 days, 100% within a week, and more than 94% they felt really comfortable with these lenses. Not only this, there have been several studies. Some have been investigator-initiated, some have been post-hoc analysis, but when we look at the visual performance, in comparison to single visual lens, whether we are looking at visual acuity, accommodative lag, accommodative amplitude, neophoria. So this one study where we looked for 1 year, there was no actual difference. When looking through halt zone, now this was one study which was conducted in actually adult population. Through halt zone, what is happening to visual performance, and there was no significant, clinically significant difference. If you look at high contrast, the change was 0.07 log mar plus minus 3. That is like one line, we're going above it. Other than that, looking at peripheral measure of vision like contrast detection, peripheral global motion processing, usual field view, these are all unaffected. And not only this, last year at AIOS2025, we presented a paper that was post-hoc analysis of our 2-year clinical trial, and that we looked at, we are looking at cornea, we are looking at the cylindrical, we are looking at astigmatism. There's no impact of Essilor Stellest lens on these factors. So it is the visual component that we have seen we are not seeing any impact over there. We'll quickly go through the clinical evidence. Now, this was a randomized control trial, progressive, for 2 years, which was in Guangzhou, China, and the age is 8 to 13. We can see the inclusion, exclusion criteria, and so on. At the end of 2 years, in terms of myopia progression, SER, it was better as compared to single vision length by 0.8 diopter, and in terms of axial length by 0.35 diopter. Not only this, for the subset of children, those who are wearing these lenses for more than 12 hours, it further improved to 0.99 diopter on an average and 0.41 mm in terms of axial length on an average. Then, not only this, 9 out of 10 children, those who are wearing these lenses for more than 12 hours, after 2 years, or within 1 to 2 years, their eye growth was quite similar or even slower as compared to non-myopic children. And that is a big win in terms of a 2-year study where we found. And it was clinically significantly better as compared to single vision length. But then we decided, let's extend the study and to 3 years and 5 years. I'll quickly move into the 5 years result. In 3 years, although we were in ethical dilemma, how can we put the same children when we have seen clinical benefit? So we decided we'll recruit another well-matched group. After 3 years, again, we wanted to extend the study to 5 years to give long-term results. But this time we decided, let's go for an extrapolated control group, looking at the studies by Champ and Smotherman et al. As to how axial length changes over year and time, and how your SER changes over year and time. Based on that, it was extrapolated based on the actual 2 years control group. The results were very promising. By end of 5 years, in terms of progression, Essilor Stellest lenses actually slowed down myopia progression by 1.75 diopters. Now, that's a big win. It was significant as compared to single vision length. In terms of axial length, again, it was 0.72 millimeter better as compared to single vision length. Now, this is one way of looking at it. Let's try to look at it another way. Let's try and see how long it took for the children, those who are on single vision length, to reach to the same power or axial length. At the end of 5 years, with Essilor Stellest, we reached minus 1.27. But those who are on single vision, they reached there in less than 2 years. Similarly for axial length. So another way of looking at it is Essilor Stellest lenses actually saved around 3 years of myopia progression. To conclude, I'll say Stellest lenses slows down myopia progression by on an average by 67% based on 2 years result. At the end of 5 years, what we have seen is the progression slowed down by 1.75 diopters and 0.72 mm on an average in terms of axial length. And not only this, by the end of 5 years, the children what we recruited were 8 to 13 years. By end of 5 years, they were between 13 to 18 years. Over there also, we have seen slowing down in the progression with the use of Essilor Stellest lenses. So, thank you, gracias, for your patient listening.
Thank you, Kunal, for that comprehensive